Okay. So in modules, I put the SNA roles and responsibilities for people that want to look at that ahead of time. The officers and reps from Student Nurses Association went ahead and gave me they did like their own summary of the positions. So president, vice president, secretary, treasurer, we have interclub council reps. You would be liaison between the club and the college. And then usually 2 people on pinning committee. We did a really nice virtual one last in the spring, and we helped with that. And then mentorship program. A lot of you probably know who is it? Ray and Kevin are doing mentorship. Then I don't have the info, but I believe Brittany is our social media PR person. So those are pretty much the positions that are available. And they can talk about that, or if you have questions. All right. Let's see. Okay, so let me go to, not clinical Labor Day. Let's go to this one and kind of go over stuff for the day. I feel like everybody's tired. I'm getting a real tired vibe from people. Is that, which is fine. I just want to figure out.
No, not at all.
Not at all. Okay. What time were you up last night? Till
I think we finished up at like 3, I think.
Yeah. Are you awake, Mrs. Solinger? Yeah, I'm awake. It's okay.
That was the longest 4-day week ever. I just want to say that.
Yeah, yeah. The first couple of weeks in nursing school are really, beyond. Like, I'm not even sure the term to use, but beyond. So be proud of yourselves. It's tough. Hang in there. You guys will get there. Hopefully we're helping to make that a little easier for you, and it will get, I was planning lectures for today is what I was doing till 3 a.m. And then Hugo had a question about something and figured that maybe I can invite you guys. No worries. I'm happy to. I'm watching Magnum PI reruns and it's all good.
Murder, She Wrote.
Murder, She Wrote. Yes, exactly. And the funny thing is, it's like my husband and I hot bunk. I don't know if you guys know the term hot bunking, but like I'm up till like 2 or 3 in the morning just because that's my time frame. I work night shift for a long time, and he's a little bit older than I am, and he's running on that like get up at 3 in the morning, 4 in the morning time. So just as I'm getting ready to go to bed, he's getting up to start his day. It's kind of funny. Yeah, no, I know you didn't miss anything. Don't worry. Let me do some housekeeping here, and then make sure everybody's on the same page, and get some questions answered. One of the questions people have had, which actually was Hugo's question, was what's going on with Success Today 225. The faculty met yesterday to kind of figure out the timing, because these are new classes for us and not being on campus. Not everybody was really aware of what the overall schedule looks like, the big picture of it. So we talked with Mr. Beamer and Dr. Whitmore yesterday to make sure that your skills labs and your farm labs, are correct. And, if you're on campus, then the other class is asynchronous and that type of thing. And I know Ms. Clark was looking at hopefully having a little bit of time if you're there for farm, that maybe she or Mr. Espinas can be on campus for one cohort to kind of do some skills in the off time. So don't quote me on that, but that's what they're looking at to try and give you some more opportunities to do skills on campus. And then for today, I'm not sure what the time is, but I'm pretty sure Mr. Beamer was going to have class today. I want to say maybe 12:30 or 1 o'clock. Her class would also be recorded, right? So if you wanted to step out and come to SNA, you can. SNA meetings are normally on Mondays, and they really just wanted to touch base with you to see what questions, and how things are going. So you can ask them questions when they're here. I just want to, so today things that were due were the, let's see. Do you have that? You have housekeeping, right? Is that the screen or no? What do you have on your screen?
No, we have your session has expired.
Oh,
Yeah.
that's what I thought. All right, let me move it there. All right, because I have so many screens. So the things that were due today were the professional identity things, and I'm pretty sure almost everyone, but maybe 2 or 3 people turned that in when I checked. That's not due till midnight tonight. And then you had your ticket to class. So ticket to class is something that you're supposed to have done ahead of time for when you come to class. So that was, hi, Vinny, I know. I'm babysitting the dogs right now. So you had to have the types of communication and therapeutic communication done, and that was supposed to be for 8 o'clock. I didn't check this morning, but I know at 3, maybe there were like 3 people that still needed to submit that. And is everybody figuring out how to submit the module report? Is that working okay for people? It seems to be, because things are uploaded, so.
Well, I'm not sure if I'm uploading the right thing. I figured I'd get feedback when I got graded.
Gotcha. Okay. I can not right this second, but I can take a look. And then upcoming assignments. So the final syllabus is finally posted. We still had a couple of things that we had to fix on it, but it's posted now. And so there is a syllabus review activity, which would be due next week, where you just have to go into the Google Doc and post one thing from either the syllabus, the handbook, or the policy and procedure manual, one like key point that stuck out to you, but you can't repeat anybody else's point, right? You can't have multiple of the same thing. It's got to be a new thing. So the sooner you post on that, the easier it is, because if you end up being student number 40, then you've got to find something. And I changed the permissions on that so that it should be everybody. Oh, okay. Yeah. Yeah, it's probably the first time you've seen it. I'm not going to take points off or anything, Kelly, because it probably is the first time that you've seen that. There's not a whole lot of those that we have in the course this year, but technically everything should be a ticket to class. Like, you should come ahead of time, but I know it's hard to get caught up with everything. So yeah, the due date was 8 a.m. So. And then next week, you guys are going over nutrition. So the readings are there. We can open up that module. It's the nutrition chapter in Giddens and your nutrition book. There's a couple chapters in the ATI nutrition book. The books have not come to class yet, so to the campus yet. So you're probably gonna have to continue to use the ebook right now. I'm trying to keep up on the chat with you guys, sorry. Yeah, the 2 communication ones, which I think most everybody did. So you should be good to go on that. So yeah, so for nutrition, it's the ATI nutrition book, and then the Giddens communication chapter, and there's a couple pages in your IGGY book. And I can show you that later, because we're gonna spend most of the morning together. How exciting. Okay, so the other thing is that, yes, there is a quiz. Don't panic. See, it says, please do not panic. We need to make sure that everybody can get on to Proctorio, right? You guys all had Proctorio for T's, I think. And so there's, I put links here for Proctorio support, and the Chrome extension you have to download. You have to do it on Chrome, I'm pretty sure, my tech guru, yes. So you have to have Chrome, and then you have to download that, the Chrome extension. And then when you go into the quiz, excuse me, it's set up in Proctorio. So the way that quizzes work will be that they will open up on 5 p.m. on Fridays. It's in the syllabus, on the syllabus page in grades and assignments. I can show you. You're like, oh my gosh, where I had no idea. It's okay. We got your back. Oh, daddy's home. Good, bye. There go the dogs. Because if you look in the grading and assignments, that will show you, I thought I had it published and I realized I didn't, so my bad, my apologies. Is it will tell you when things are due, how many points they are. The ATI assignments is kind of broken down into the different assignments, and then at the bottom are the quizzes. So I'm talking about the week 3 quiz right here. So anytime there's 1, 2, 3, 4, looks like there's 5, 6 quizzes, They'll open up on Friday at 5 p.m. and you have until Sunday at midnight to complete them. Okay, because you're on Proctorio. And so the thing will be like when you're ready and you get your environment set and all that, then you're able to take the quiz. This particular quiz this week, oh yeah, we can go over T's, not right this second, but yeah, for sure. Right, so it opens at 5 and closes at midnight on Sunday. So you have that whole entire time not to take the quiz, but to prepare yourself to take the quiz. Quizzes, generally speaking, are supposed to be, because it's multiple choice, is 1.5 minutes per multiple choice question and 3 minutes per like math question. I also give more time if there's a short answer question, because it takes you a while to figure out, you know, what you're gonna write. And I tend to put those at the end of the quiz, right? So you're not taking up all your time, you know, in the middle of the quiz. You can think about it at the end of the quiz. For this particular quiz, there's 5 questions. They have to do with professional identity. What kind of questions do you think we could potentially ask you about professional identity? Anybody? Remember, we talked about professional identity. What was some of the assignments you did for that? Hello? Did I lose people?
Do you want real voice answers?
Yeah, either that or the chat. I didn't see anything in the chat either. So, oh, maybe there's one in there in the chat. Real voice.
To come.
So nursing is a profession, or out loud. Yeah, like any activities we did, or?
5 C's.
5 C's, that is a good one. There's probably a question on the 5 C's. Because you guys did an activity about that. Not always, it's not always how it works, but for this one I figured 5 C's. It's probably a question on 5 C's. There's a question from Ms. Clark's PowerPoint on, what did she do? The not healthcare law, scope of practice, that stuff, right? So there's a question on that. And then there's a couple other questions that are more like opinion questions, or asking you about things, you know, from during the week. And then for this week, you get 2 attempts on the quiz, right? So if you take it once and you miss a question, you can take notes or whatever, and then you can go back and take it again, right? So that's low stress, hopefully. You also have 30 minutes. So even though there's only 5 questions, which would normally be, I can't do math, 15 minutes, 1, 2, 5, 10 minutes, something like that. You have 30 minutes to do this, okay? So what I will tell you, and I can put it in the directions, is if you, because we won't usually do like open book type things, but if you need to use your resources, I'm fine with that this week, because this really is, make sure you're on Proctorio, look at the type of questions you're going to be getting, and so that you're prepared for that as the next quizzes and exams come. Does that make sense? So our hope for you, I talked with Ms. Clark, and our goal for you is that by the end of the weekend, you will have all earned 10 points on the quiz. Specific, measurable, right? And I'm always, as you know, available on Hangouts. So it does say, the directions do tell you that if you have questions or something doesn't go right, get a hold of me on Hangouts, and I can kind of help walk you through it or work with you on it. And again, you can take it at any point over the weekend.
How does that work? Is Proctorio, I think, like shuts down your screen, or like it
I don't have it set to shut down your screen. I can make that one not to shut down your screen, because I don't think I usually have it to shut down your screen. What happens is when you're done, everybody's done with the quiz, Ms. Clark and I go in and look at the trends. And if somebody has a whole lot of red, we go and we look at and see what you've done. So this isn't like with ATI. I think ATI probably has it set like that. For us, we set it our own, we can put our own settings on it. And if it shuts you down, then let me know and you have a second attempt. It shouldn't shut you down because I don't have it set for that. Ooh, I like that. Be a nurse inside and outside of work. I didn't see that, Francisco. That's nice. I like that. But that's also like, you're not going to need to, I don't think you're going to need to use your resources. So don't freak. I mean, I could answer the questions. So I think you'll be fine. And my thought would be, you get to take it twice, right? So the smart person, probably prudent person, would like take it, do their best. If they score, you know, do well, then that's great. If they miss some questions, you know what the question is already, right? You can go back before you have to actually take it the second attempt, right? And then, I mean, that would probably be the way I would do it, right? Because it's not one attempt, right? It's two, you get 2 attempts. Does that make sense? Somebody, anybody? Okay. What is this screen we're seeing with all the assignments and dates? I want that. You have that, Greg.
Where is it? Where is it? I feel like
it's in the modules. Oh, this one I'm looking at right now, this is in the syllabus. So
okay.
if you go to your syllabus.
Yeah.
And I'm not in your view, sorry, but and so you have the document, and then you have all these links here that take you to specific portions of that document.
Yeah.
And so I was on the grading and assignments page. There's also a question distribution page, not for the quizzes yet, but for the exams. And so what that is, hold on while I open it up here. And then flip over the screen.
I think you said that was just opened or just published this morning.
Yeah.
Okay.
Yeah, because I've tried to click that before and it gave me a loss.
Yeah, I honestly thought it was open, and I was going in last night and I'm like, oh no. So I opened it. And so then this is the question distribution for the exam. So this would be the, we're not doing 100 points. We're doing like the 70, 90, and 120 points. So it tells you how many questions for each topic, multiple choice, fill in the blank, you know, like how many questions you might have. So that kind of pinpoints it for you. I don't know if we're going to do study guides. We'll probably do some type of review, not like review session, but just so to point you in the right direction for that. So, and one of the other things that we can do, or that, you know, you guys can do amongst yourselves, is like either practice writing your own test questions, or like ask each other, what do you think they're going to ask? What kind of questions do you think they're going to ask? I can tell you that Ms. Clark and I are not the kind of people that look for that little teeny tiny print at the bottom of the page, you know, page 32 in that little itty bitty box. So you shouldn't have to worry about that. And then I'm not sure about the 2 attempts. Exams, no, you would not get 2 attempts on exams. We are trying to, our course that we took for online learning suggested that quizzes be lower stakes. So we're taking that into account. Yeah, I didn't know that either, Kelly. We were supposed to be checking out. We didn't know, which is why we didn't tell you. Okay, so let me go back to where we were. And this is all part of communication, right? Because the topic for today is, there's your syllabus, is communication, right? And then, is that what I want? No, I want that. So this one, I have a couple links in here. A lot of this I took back from 110, right? So you may have seen, I don't know if you guys saw, you can access this, right? But then I think there's another link that doesn't work that I'm gonna have to fix. But this is, you know, just information. You guys have heard this. It's just more of a refresher. Because what we're gonna focus on today is therapeutic communication, and we're gonna talk about SBAR or ISBAR. So I'm gonna go into the lesson and make sure we hit all that first. We did. So there's your links for Proctorio there. The quiz is in the modules. That's how you access the quizzes. There is not a quizzes tab. So you access it through the modules. And then there's Proctorio. And I guess, can I offer Hugo or someone else? Is there another tech person? Who's our like backup tech person in the class?
There is only one.
Yeah, Hugo does not need backup. We have to rely on him for everything.
Ninja.
Oh
I
my
came up
goodness.
with Proctorio as well.
Is that Amanda? No.
Emily.
Emily, sorry. I was doing that off voice. I only have like 4 people on my screen. That's awesome. So yeah, Emily can help too. So there we go. And then if you are going to Clínica de Salud on next week, I'm going to have that information posted later today. If you want to stay after class for a couple minutes, I can review some things with you. That's fine. I still have to go over today and pick up a couple things and talk to some people over there. Any questions? I'd rather take questions at the end of the class, but anything pertinent to what we just talked about before I move on to the lesson? Okay, and what will happen today is, so like the SNA will join us. I gave them the link. They'll come maybe around 9:15. So we'll finish up by then. And then at 10 o'clock, we'll have 47. Ms. Clark's gonna come at the beginning of class and talk to you about some of the community activities again, make sure everybody's clear on those and where the signups are and what's available. Understand that we're going to continue to get new opportunities as the semester progresses, because they're going to be adding the flu clinics, immunizations, things like that. So there will be opportunities for more community things to do. Alrighty. All right, so communication, we're going to kind of talk about therapeutic communication. Interrelated concepts that we're also talking about, we'll talk about culture and spirituality. Safety is always an interrelated concept, and clinical judgment is what we're going to help you try and develop. So the objectives for the, for the lecture today, or the class today, you know, looking over the different types of communications used by professional nurses. So you guys are going to tell me what you got out of that particular ATI module. Different types of things like active listening, silence, open-ended questions. We'll go through those, and then closed-end. You know, the opposite. What is non-therapeutic communication? We're going to check out the your clinical portfolio tools, so you kind of know how to use that, and then you're going to practice some SBAR things. So let's see, where we go. And so we have a couple videos on SBAR, like a good one and a bad one. We'll look at this in your fundamentals book. I'll show you that. There's also a therapeutic communication video for a patient that had a miscarriage, and good ways and not so good ways to talk to the client. And then in the supplemental resources, this should look familiar because this was in 110, just like different things, parts of communication. So you guys can refer to that if you want. So who can tell me about, I don't always have PowerPoints, by the way. I'm not necessarily a PowerPoint person. I try to have PowerPoints, but just so you know. So what did you get out of the types of communications, right? You had to do that types of communications, nurses touch, right? And so what were some things that stood out to people? I can take chat, or I can take verbal.
Welcome, Mrs. Sillinger.
I'm sorry. Oh, hi, Claudia.
Hello. Morning.
Hi. Good morning.
I was up during the night, just like you.
Yay.
I saw the activity that was going on. For what I got, honestly, it's one of my favorite for ATI communication. It's something that I'm still continuing to learn, and I really, really like this one. I always go back to it a lot. My favorite one is open-ended questions, because I feel growing up, I was more in my culture raised to just answer or questions to close-ended questions. So I love the description and the videos that they show on the open questions to ask like what and how, giving the the client the opportunity to hear them out, to understand them. And I really like that. And it's something that I continue to work on.
Oh, that's great. Thank you. Yeah, I think it's hard sometimes to get into that frame of mind, right? Because you're really to open-ended questions, like a lot of you are saying in the chat, open-ended questions, and the verbal, nonverbal, right? Because those are the types, right? Verbal, nonverbal. You guys had a whole exercise in 110, right, on nonverbal communication with that Friends video, right, which was posted again. And being able to, I think it's important to be able to read people's nonverbal communication as well. Yeah, not making the conversation about yourself, but showing empathy. So a lot of times it's nice to, if you can sort of give an example, but not take over the conversation, right? Just let them know that they're not alone, but not like it's not all about you, right? It's about them. And congruence, right? Verbal and non-verbal. And that's a good thing in, you can use that a lot in pain assessment, right? Because you can go in and you're doing your, hi, I'm here, how are you feeling? How's your pain? 0 to 10, blah, blah, blah. And they're like, oh, I'm not having any, I'm not having any pain. And yet they're like, I'm not having any pain. No, I'm not, or whatever. So, and there are some cultures where it's sort of a taboo to show somebody that you're having pain. So that's why it's important to to look at the congruence. Absolutes, right? I know exactly how you feel. No, I don't know. Nobody knows exactly how you feel but you, right? So so those are great examples.
Yeah, for me, I like eye contact because coming from another culture, in my culture, eye contact is a lack of respect. Mm-hmm. So whenever I'm working on communication, I always try to work on that in the most of the part to get myself, in the level of being comfortable with my client.
Nice. That's great, Armel. Thank you for sharing that. That's, yes, because there are some cultures where eye contact is not important, but it's like a sign of disrespect. And so trying to be aware of that or not taking it personally is important. I'm glad you're working on that. That's really important. And then provide reassurance. Right, so you want to provide reassurance, but not false reassurance. So we have to be careful with that, right? But you don't want to discredit their feelings and desires, exactly, because they're theirs. Why is silence important in communication?
So, Ms. Sandra, can you hear me?
I can. Is that Marco?
Yeah, my camera's not really working this morning.
I only can see 3 people, so I'm going off my voices. So
with silence, my understanding it's giving the client the opportunity to really process, what they're thinking. It's giving them, time to. It's showing them, overall, it just gives them time to think, on their decisions, on what's going on, before they act on what they're going to say.
Mm-hmm. Exactly. I like that. It shows you're actively listening. It can allow the patient to talk and expand more. And then Amanda, I love that healthy boundaries, like not giving out your phone number or sharing personal experiences, especially things that we'll talk about this for home visits in 47, but things that can tell them where you live or what, too much about your personal life. Silence is hard for me because I like to talk a lot. Not that you figured that out yet, but sometimes just being able to sit there with somebody, how easy is that to sit and be silent, to be with someone?
I find silence awkward and uncomfortable.
Yes.
It's hard to sit. I mean, I can do it for a short amount of time, but then I want to move things along. So
right.
Only have your feelings for about 30 seconds and then we need to move on. I'm just kidding. But
no, but you're right. And it can depend on the situation sometimes, but sometimes it can be really, really therapeutic. And it's difficult. You guys will find when you're working with your clients to find that balance, right? Which is really important. How easy would it be to have a therapeutic silence with a patient when you have 3 patients and one's post-op and one's going for surgery, like, and you're really busy? Kind of difficult, right? So it can be, sometimes it's hard to be a therapeutic nurse, right? But hopefully you can carve out time for that. Active listening, right? So what are things that can show, what are characteristics that can show your patient that you are actively listening to them?
Asking clarification questions.
Mm-hmm. What about nonverbals? Oh, sorry. Yeah, go ahead. Yeah, eye contact. Mm-hmm. And sometimes I think even like leaning in a little bit, you know, getting not too close, right? Because there's a bubble there. Same physical level, right? Leaning forward, good. So oftentimes what I'll do, I'll pull a chair over to the bedside, right? Because you don't want to sit on their bed per se. Although we used to ages ago, but I usually pull a chair up, right? So I'm at their level and can talk to them. Or if it's kids, I'll kind of squat down a little bit to be talking to them. So it's good. And then open-ended, I mean, can you ask a closed-ended question?
Yeah.
When would you do that?
On a scale of 1 to 10, was there?
There you go. Good example, right? Sometimes you have to because you need certain information. So you may. But we were talking, I can't remember who I was talking to, but when you're at Clínica de Salud, the MAs will do intakes. And no offense to any MAs, because I know we have several. But in the computer, right, as a medical assistant, you're going through the intake. You're just asking the questions, right? And so you might ask a question. I was actually there one time, and the question is, you know, does the child sleep in bed with you? Like that was the question. It wasn't like, where does the child sleep or how often, or does the child sleep in bed with you? And the mother answered yes. And then the MA went on to the next question. And I kept thinking, but we need more information about this, right? And so we talked to the mom later in the room with her, but sometimes you need to get off the script, right? And kind of, sometimes you might have to ask more open-ended questions. There could have been a lot more information gathered had the question been phrased a different way. And then you have your focusing, giving right? Yeah. What about offering? So I'm looking through the objective here, and you guys talked about offering self. It's okay to offer, not too much, not too personal. Presenting reality, more like refocusing them. I think acceptance and recognition is a good one. In what way would that be good, or should you do that? Sorry, I'm laughing at Kelly's comment. Yes, I always thought they asked us so they could lecture us. Yes, but when they're doing the intake, it's like yes or no. They don't do the teaching. They put it in the intake, and then the physician is supposed to deal with it when they look at the information. But I think it's such a lost opportunity to educate. So acceptance and recognition. You want me to give you an example? Sure, Mrs. Solinger, go right ahead. Okay, I will. So sometimes the, yes, please. So sometimes maybe the physician has just come in and talked to them, and they have, like, they're devastated, or they have no idea. Like the physician just came in and gave them a bad diagnosis or told them something they didn't want to hear. And so the nurse then has to go in and sort of deal with that situation. And so it's good to, you know, are you all right? It seems you might be upset. Can you tell me about what the physician, you know, just said to you? You know, and they're going to tell you, and they say, you know, well, I recognize that you're feeling upset. You know, it's kind of like a reaffirming kind of thing. That would be one example that comes to my mind right away. But it could also be, I mean, I don't know, there's lots of different situations. Doesn't mean you have to agree, right, with whatever the situation is, correct? But just to show that you're listening and you accept that they have their feelings. And I think that can be hard sometimes. Let's see, close-ended questions we talked about, irrelevant personal questions, personal opinions. So can you give them advice? I really need a different pediatrician. Can you tell me what pediatrician you use? How do you answer that question?
Maybe direct them to a page with pediatricians or, you know, online resources so they could find one. Yeah.
That's the standard answer, right? You know, and that would be one of, you know, I hear it sounds to me like you're saying that you're frustrated with your current pediatrician. I'm really sorry that you feel that way. Let me direct you to, we have this directory here, or there's this website, or there's whatever, where you can look up other, you know, reviews about other pediatricians, you know, that kind of thing. Giving false reassurance. So the doctor comes in and tells the patient, you know, you're going to, I mean, cancer is a bad one, but like, you know, maybe they have a cancer diagnosis and you come in, oh, you're going to be fine. It's okay. You know, you'll get through your first chemo and yes, you'll be nauseous and sick and bald, but you know, it's okay. You're going to make it. That's that's an extreme. But right, false reassurance, we don't really know what's going to happen with the patient, right? We have experiences that tell us what probably the course of action will be and the trajectory of the illness will be. But it's really difficult because you want to say, it's okay, everything's going to be all right, but it may not be. And so we don't necessarily want to give false reassurance. One of the big ones is changing the topic. Right? Because what happens if we're talking about a really difficult, difficult situation? They just received a diagnosis that they have cancer. Yes, it does. Yeah, it kind of has to do with the fidelity, saying things and being someone they can trust. And I don't think me personally, I don't think we do it on purpose. I think that's just part of our nature, right? It's like, you know, as parents or as good people or whatever, it's okay. You know, we're going to get through this. But yes, you want to acknowledge that it's a difficult situation. Yes, if you dismiss them and change the topic, thanks, Vanessa. You know, we're talking about something and then all of a sudden they change the topic, right? Why are you changing the topic? I'm having this conversation with you. Please don't change the topic. So what's the deal with why questions, asking why questions?
They tend to sound, oh, go ahead.
Sorry.
Go ahead.
It can seem like you're coming from a place of judging, even if you're just curious. It automatically kind of makes them feel like they're potentially in the wrong about something.
Mm-hmm. They can get upset, make them uncomfortable, defensive, aggressive, make them feel they need to prove why they're feeling the way they're feeling. I think sometimes the way you phrase a why question, I think what happens if it's why, you know, you keep asking, I mean, we tell you all the time, ask the 5 whys, keep asking why, but in your head, not to the person. But that's one of the things that I think, like Crystal's saying, they have to express themselves further, even if they don't want to, but that's probably why we're asking why, is because we want them to further elaborate. So if we can find a different way to say that, you know, would you be willing to share with me why you feel that way? Or it's the question that starts with why. Well, why do you feel that way? Oh, well, why is that? You know, and and then they feel defensive. Yeah. What makes you feel that way? If there's another way that we can ask it, yes. Why couldn't it be done nicely for the, yes. Mm-hmm. If there's another way that you can say it, Christine, do you have examples of that? Like the why, on the why questions? Yeah, to be nicely, you can say it nicely. I didn't know if you had any examples. I'll put you on the spot. Sorry, never mind. I don't want to put Christine on the spot. Right, so sometimes you have to ask a why question. So just be aware of the way that you're asking it. Yeah, excessive questioning. So you're doing an admission, right? The admission is all about asking questions. How long does it take to do an admission? Anybody that has ever done an admission? Christine? Forever. Selena, 1 hour. Yeah, it can take longer, right? It depends on the situation, on the setting. And so you're in constant, that's like excessive questioning, right? Because you're asking and asking and asking. So sometimes you can intersperse that with some, doing some things or talking about something else, and then come back to asking other questions. But that's really hard, because it's just like, and what brought you here today? And you're doing 20,000 things, and they probably don't feel well, which is why they've come to the hospital. Assumptions. We've talked about that, like in 110, not to make assumptions. Cliches. What's a cliche? I can't even think of one, because I can never think of one.
Every cloud has a silver lining, like that kind of thing.
Like something like that. Yes, exactly, Amy. Like quotes, right? But not everybody, different cultures or different people with different backgrounds may not understand what that means. So you have to kind of be careful about those. If you do say something like that, check the nonverbal response, right? And then if it looks like maybe they didn't understand what you were trying to say, then you can clarify a little bit. Yeah, if it takes longer, that's, you open up the comfortable feeling, because it's really good to have a therapeutic relationship as well, right? With the patient. I think we covered that. All right, so we've gone through 3 of 5 objectives. Yay, team. Okay, so let's go ahead and look at your clinical tool, and then we'll do some breakout work and looking at the videos. So for your communication and interprofessional collaboration communication tool, for you guys in first semester, we're asking you to look at 2 interactions between yourself and a client, and 1 interaction between yourself and a healthcare provider, or an interprofessional team member. So respiratory therapist, OT, PT, nutrition, something like that. And so what we would like you to do is, it's going to ask you, for example, your first interaction, the nurse, that's you, right? So what did you say? Try and use direct quotes. It's a lot easier to do that. Like, what's the situation? What did you say? And what did they say? Right? And then, did you consider that to be effective or ineffective? And be specific with that. And then, what impact did that have on client care? So can somebody think of like an example? Or like ask a question. You could do like I can be the patient. So you guys can ask me a question and I'll be the patient. Or you could type it in the chat box.
Can we just use pain? Because that seems like one that everybody, can we open it up with pain?
Sure,
like,
sure.
Hi, Miss Solinger. I heard you're having some pain. Can you rate your pain for me on a scale of 0 to 10?
Right now, I'm probably at a 3 or 4.
Okay, and can you tell me a little more about that? Where is it located?
Actually, right now it's my left hip, and both my knees are not doing too well right now.
And can you describe the pain?
It's pretty much a dull aching pain everywhere. I think I slept wrong last night.
Okay. You want more questions?
If you're doing great. Oh, there's Christine, right? When did the pain start? There you go. You got some backup here. Actually, this is chronic pain. I've had this pain for a while. The back pain actually, though, is worse this morning because I do think I slept wrong. So what else would you want to know? You're doing great. You guys are doing great.
Are you taking any medications for the pain? Or have you had this pain before?
I've had the pain before. Like I said, this is a chronic pain, but you know what? I didn't take my Tylenol yet this morning. So that could be why. Oh yeah, long history of illness related to those areas of my body. Sleeping wrong makes it worse. Standing on my feet all day makes it worse. Yeah, sleeping wrong. What does that mean? It means I got 4 hours of sleep and slept like this. More clarifying. Anything that makes it feel better. Nice. Yes, heat makes it feel better. The Tylenol makes it feel better, right? So these are great. You guys are, this is perfect. Does it radiate anywhere? No, not really. So what would you put in your interaction form now, right? Amy asked some good questions. You guys are adding in. Yes, would you like me to get the nurse to see what pain meds I can get you? Perfect, there you go. Hopefully you know already because you've looked in the chart as to what the, what's ordered for the patient, but yes, or non-pharmacological approach. Yeah, can you rub my back for me? No. But you could get heat, like maybe a heat pack or something, or ice packs. I like ice packs too. And you could do hot, cold, balance, excuse me. So what you're gonna write on your tool, right, is what did you say? You're gonna write, part of that conversation. Maybe it's the beginning, the middle, end, whatever it was. And then what did I say? And do you feel like that communication was effective or ineffective? So Amy, what do you think? Do you think that conversation was effective or ineffective?
I think it was effective. I mean, we kind of tracked down your pain and got to
and
some
somebody's
solutions.
gonna go get me some, yeah. So I would say yes, that was effective. So then you would go back and give a specific example, like we talked about non-pharmacological and you got an ice pack. And I said, yes, ooh, that was very helpful. Or, and then you went to check the order and it was, I went to go get some Tylenol. And so that, was helpful. And then, so what was the impact on client care? Right, where you assess for the pain and we're talking nursing process here, right? So you assess for the pain and you had a plan, used pharmacological, non-pharmacological methods. Your goal was that. So what's your goal? What goal would you set for me? Anybody, not just Amy, sorry. So make the client feel better. Yes, needs to be more specific than that. Low pain level.
A client will be down to a level 1 or 2 in pain by the end of the shift or less, depending on where you are in your shift, I guess.
Well, shouldn't you kind of ask the patient where they would be comfortable being at?
Yep.
Before assuming that they could go down to 1?
You read my mind. So yes. I mean, yes and no. So, I mean, I live at a 3 to 4. So that's just where I live. What they say is tolerable for them. So, you could say like Mai's saying, or you could say something like, well, if you're at a 4 out of 10 right now, what would you hope, where would you hope to be? What would be an acceptable pain level for you after taking some Tylenol or after we get you some ice packs? And I would say, oh, maybe a 2, right? Measurable goals. Amanda said that really nicely. A question you allow the patient to expand on their pain and health history, which is nice. Yeah. So does that make sense for filling the form out? Whoa, that was an echo. Like the impact on client care. So you'd come back in an hour and reassess my pain. And I tell you that it was a 2 out of 10. Right. And so then how did that impact client care? So there was a goal set and the goal And it was a mutual goal, right? You set it with the patient, right? So do you think you'd be able to fill the form, the tool out? Does that make sense? Yes? Okay. And then we have these little reflection questions. So I've learned I can identify whether my communications are effective or ineffective, because you're going to have to practice, right? It may come somewhat naturally, but you're going to get in that room and be like, ugh, now what do I do? Now what do I say? And then how did you have to adapt to, unique characteristics, language, culture, that type of thing. And then with, were there any potential legal ethical consequences? Probably not, so that's not applicable. And then what did you learn? And how can you improve your communication? And then it would be the same thing with the healthcare team member, right? So you're just going to give an example. Now, depending, I have a really good example from last semester. We had a patient that was readmitted on the pediatric unit, and we had some concerns based on lab values, things that were going on. And not only did the student nurses and myself, but the staff nurses on the floor had concerns. And so the student and myself and the nurse, we talked about it. We agreed that, yeah, those were concerns. And so we're working on the care plan. And the physician the surgeon happened to have been in the room with the patient and come out. We didn't realize it. We're like, oh, good, we can ask him our questions. We can, we have these things that we want to talk to him about. And he was also with she was either a resident or I think she was a resident. And so the student went up perfectly, asked the question, SBAR, totally did SBAR. And he just kind of looked at her, I'm not concerned about that, and walked away. And the resident just kind of flipped her hair and rolled her eyes and walked away. I'm like, oh, which is very disconcerting, right? And so, but that would be a negative, right? That would be an ineffective communication. We did everything we could to try, and it just didn't work out. And that's okay. If you have that, then you have that. So Amanda's asking on the, should you have those completed first or second day? So here, let me show you someplace in the modules. In the modules, you have in the clinical paperwork clinical site, whoa, that was a lot. Scroll back, clinical paperwork. If you go to this completion verification form, and I had to do that a couple times in working with your the clinical instructors, and so this will tell you when things are due. So for example, what was that? Our collaboration, right? Interprofessional collaboration communication. By mid-semester eval, so like week 8, there's 3 total, right? 2 student and 1 healthcare team member. So you have to have at least 1 done by week 8, your mid-semester eval. And then the other 2 done by the end of the semester. Oh my goodness. Okay, and then let's go back. Oh, it's gonna scroll for me, isn't it? Yeah, there it goes.
It's good to know the dog is feeling our pain as well.
I know, well, he misses it. I don't know. My son went to go lift, and so he's like, oh, I want, and he can't find the other dog because the other dog's sitting lying behind me in my chair. He misses his friend. Okay. Let's see. Is this making sense? Hopefully it's helping a little bit. Let's look at, I don't know if this will take me to it or not. Maybe not. Oh, well, it actually went there. Except there's not going to be any sound, is there? Can you guys hear that? No. Okay. So what I'm going to ask you to do is okay, so do you know how to, wait, where'd it go? Hold on, I have it. 1 minute, please. That one. It was that other screen. Yes, please log in again. Okay. Have you been in your ebooks, your ATI ebooks? Yes.
Come on, everybody say yes.
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 Yes. Okay.
Yes.
Whether you have or not, just say yes. No. That was the OSA. So we are looking, I am in the fundamentals ebook. Okay. And I'm going to go to like chapter 32, which is therapeutic communication. And then it will bring up the chapter for me, right? Can everybody see that? Basic communication? Yes, thumbs up. Yes. Okay.
Yeah.
So what, and again, this should all be mostly review for you, which is great. When you get down to, there's this part here, therapeutic communication, and there's this little part here, this video enrichment thing. This is the video to watch. So I think what I'll do is put you in breakout groups in a minute and have you guys watch the videos and talk amongst yourselves. And then when you get to the end of the chapters in the ebook, you have these active learning scenarios that you can, that ask you questions that are good, like study tip questions. And then it also has application exercises where it actually gives you some multiple choice questions, like 5 multiple choice questions. So I don't know if you knew that or not. You may have, I don't know, but that's really helpful. So I just thought I would point that out to you. And so if you can, are those things ever going to be required? What things?
Like the little extra end of ebook chapter stuff and things
No,
like that.
not usually. And if so, it would be in this scenario where we're going to do it together.
Together. Okay, great. I'm really looking forward to getting my physical books because I'm definitely like a.
I'm sorry.
No.
And so when you go there, there's a therapeutic communication. It's like five minutes. And you guys can watch it, and then, hold on, let me check one thing. Because if this, I think I want to do the other one, and I want to have you do the other one instead, because I think it's a little more, not tricky, but it's a little more, what do I want to say? Sensitive. Let's go with that. And so that one is in, yeah, this is my end of ATI. Here you go. Let me see which one. Therapeutic communication. Make sure I have the right one. And the thing is, I can't cue the videos because it logs me out of ATI, right? If I'm not on the site for so long, it'll log me out. So let's see, there we go. Are we having fun yet? Yes. This is why I go to your student view, because it's very confusing to to do it this way. How was EHR yesterday? Right, Mr. Spinas went over EHR. I know he went over EHR. Was it helpful? Did you learn anything? Are you able to get in and make your own patient? A lot of information, great, good. Yeah, and he's got a lot of experience. I posted a video, I don't know if people saw it, from my deposition experience. It was on the overview. Oh, how to add it, good, yay. This takes forever. I feel your pain. Camera. Oh, you're welcome. Yeah, I was pretty scared. It was, documentation is a must. I will say I was proud of myself though when I went back. I knew I had to do it. So we are in Nurses Touch. No, we're not. Professional communication. Let's look at that one. And then we want therapeutic communication. And I think you probably already did. This is the one with the woman that had the miscarriage when you did the module, right? Oh, hush. Therapeutic. No, that was. There it is. That's what I'm looking at. So do you guys remember when you did, right? Because you guys did therapeutic communication, right? This is the module that you did, correct? Yes?
Yeah.
Yes.
Yes. And so the nurse is talking to the patient. It shows you, I think, good and bad, not good and bad, but like showing empathy. And then the other nurse, there's another one where the nurse is like, it's all about her kind of type thing when she's talking to the patient. So what, I'm going to stop sharing my screen. What I would like you to do is to go into breakout rooms. I'm gonna put you in breakout rooms and take like 5 minutes and talk about what you noticed, you know, what were the good things? What did they do well? What, you know, like compare and contrast, and looking at like the nurse, how the nurse presented herself, because I believe both scenarios was the female nurse, and then the woman, like what was her response, and like what were her nonverbals and verbals, like what did you guys notice about that? So just sort of have that conversation. If you need to pull that video up again to watch it, it's only like 1.5 minutes. You can certainly do that, and then I'll bring you back. So how big you want your groups?
How long do we have, and how deep into conversation do you want us to go?
Like 5 minutes and medium depth, light to medium depth. How's that? Is 5 good, or you want to go like oops?
Probably 5 sounds good, I think.
Let's do 3 to 4. How's that?
Okay.
Okay, automatically. All right, have fun. There we go. Open all rooms. And there they go. Okay, Selena, do you have a room? Yes, you do. There you go. So how is that? What takeaways did you get? Let's do like positives. What were some positive things you noticed?
So one positive thing that I noticed with the video of Ms. Solinger is that the first nurse, she kept, she kept the conversation on the patient's focus versus taking over and, mentioning her experiences till the end. And then, another thing that I did take in is like sometimes by sharing a little bit of what you've experienced in the past can be helpful.
Yeah, no, that's great. I think that's great. What do you think about the nurse in the second half? Do you think she realized she wasn't being as therapeutic maybe as she could have been?
Yeah, I think she was not as therapeutic as she ought to have been, because at one point she was asking the lady why she did not have children when she was much younger. I think that's interfering in somebody's personal life.
Too. Yes.
I mean, sure. Of course, yeah.
Yeah, cross that boundary.
Over.
Yeah. Yes, exactly. But like her demeanor, I felt like she was
she was very flippant. She was very just kind of like, That was the word that came to mind. And
offering,
she was also
yeah.
like kind of rushing through stuff at points. Like she was trying to chart as she, you know, as she was talking and stuff, and just being like, oh, you know, everything will be fine, or whatever, you know. And I was just,
yeah, exactly.
She kept on giving false assurances, and she was not actively listening.
Nice. I'm glad. Yes.
Yeah. The one thing that really like irritated me was that she wasn't taking the time to really assess the client, especially when she was concerned about the bleeding. Yeah.
Right. So that's acknowledging, right? You'd acknowledge and accept and that's a concern for the person.
I think especially with a miscarriage, there can be a lot of depression and feelings of self-doubt and other stuff afterwards. So the fact that the nurse in the beginning was kind of doing things that are making the patient feel even worse could potentially lead to a really cataclysmic event, and have a big impact on that woman's life, you know, or lead her to do self-harm stuff. So I think we have to just be really cognizant of how our words may affect somebody else. Even if we don't feel like we're being aggressive or antagonistic, they may be perceiving it that way based on the situation that they're in.
That is well said. What if you're the nurse? What if it's change of shift and that nurse did, you know, had that interaction and now you're the nurse coming on shift? What potentially are you going to have to do?
Massive damage control.
Potentially.
You know? I mean, and like have to try and get
without throwing your coworker under the bus.
Right.
And sometimes that's the difficult part. Right? Because
and maybe the patient will not trust any of the following nurses, just assuming that they're going to treat her the same way.
Yeah, exactly. So that can make it more difficult for the team, for us, the other nurses that are in there caring for the patient. So sometimes your interaction, whether well-intentioned or not, sometimes can have a ripple effect for the patient and for your coworkers. Let's move to, so what do you guys know about SBAR communication? There's a couple links here for you to look at. Like what do the letters stand for?
Situation, background, assessment, recommendation. There
you go. And so there's an article here that talks about it, different guidelines, you know, how to talk to different, you know, physicians or coworkers. There's an article there. There's a worksheet here. When is SBAR, when would you use SBAR communication?
Change of condition.
Change in condition.
If you don't understand the medication.
I'm sorry, say it again.
When you're reporting to another member of the care team.
Yeah, like change of shift, talking to the next nurse, a deteriorating patient, talking to the doctor. Very good. And so situation, right, I'm calling. So I like to do SBAR, and then sometimes there's another R, but I always like to introduce myself, right? So that they know who they're, like, especially if I'm on the phone, right? Not necessarily if the physician is there with me, but if I'm on the phone, yeah, new admission too. If I'm on the phone, hi, this is like when I used to call for the example I gave you yesterday. Hi, this is Shanine. I'm calling from the nursery. I'm calling about patient X. I wanted to, you know, this is our patient who's a 34-week preemie, currently under phototherapy, blah, blah. And then that would be the background. You know, I've just done the 3 o'clock vitals, which are blah, blah, blah. And then the assessment is that I just changed the diaper and there was what appeared to be blood in the stool. I went ahead and did the guaiac test. It came back positive. So I think there's a bleeding problem someplace. And so then the recommendation, sometimes I'll wait for the physician to tell me what they think they might want to do, or I might say, would it be possible to discontinue the rectal temps? Would it be possible to make the patient NPO? Would you like to order an X-ray? Something like that. Have those of you that have had experience with SBAR, any tips? No? Okay.
For the only thing I would say, is just like be confident, because like if you feel and you seem like you don't know what you're talking about or recommending, like the doctors usually will dismiss you and just be like, they don't know what they're doing.
Yep. I've had several of those. And somebody else was saying something. Was it Emily? Like write things down? Yeah, this is a template, I guess, that SVMA, or no, this is Keith, RN. So it's kind of the same thing. You want to prepare, even if you're having the face-to-face conversation, I always write a little cheat sheet down, right? Gather all the information to create the picture for the doctor. That's perfect, Christine. And I will continue to, you're painting a picture. You're painting a picture for the next person that's following you, the person that's working with you. You want to paint that picture. So I'll write down what I know, my SBAR, and then I'll think for a minute, is there any other information that the physician or the person that I'm wanting to talk to is going to ask me or is going to want to know, right? And so I found blood in the stool and guaiaced it, but I better have some vital signs. Like I better be able to tell the physician what the temperature, the pulse, the O2 sat, the respirations, like I need to have that information. And even on a neonate, we can do a blood pressure on the machine. What else might the physician want to know in that scenario? Allergies are important. In that particular instance, the baby doesn't have any allergies, but yes. If there was any labs, amount of blood, right? And so how would you describe an amount of blood? You could do mLs, could be dime size, quarter size, something that's a quarter size, perfect. There we go. See, you guys are on the same page. You got this, nice. And so have that information available, because there's nothing worse than them saying, well, what's the white blood cell count? Because they know they did labs on the baby yesterday and you didn't, you have to go look it up. So try to think. You're not always going to know. And I have had some physicians ask you totally off the wall things because, but COCA, yes. Vanessa, what's COCA?
Color, odor, consistency, and amount.
Yep. Abdominal status, nice. Like is the abdomen firm or does the baby flinch? Like what's the baby's pain scale? Is the baby eating? Can you do color, odor, consistency, amount? Awesome. And then there's also, this is an article that I put on this page, reformatting SBAR to iSBAR. So I being the introduction, introducing yourself. What I found interesting is the article's from 2008. I thought that was amazing. So like we've been talking about this, the whole time, which I thought was interesting. And having cards, to talk about, practicing the scenarios and that kind of thing. Let's see. Okay. So let me go back here. I'm trying to juggle here for a second. Are the SNA people? I can't look. Is anybody from SNA or Men in Nursing here yet?
Yes, we are.
Oh, you're here. Oh, hey, Sonia. Hey, give me 1 second here to make sure I covered everything. So it's hard to do an SBAR like practice because we don't really have a scenario, but you could practice like amongst yourselves, or once you get into clinical next week, even then be thinking about how you can do an SBAR, like what you would do, what components. So Sonia, you guys third semesters, what's your experience with SBAR? What advice do you have for first semesters on SBAR?
Ask the nurse you're following how to do an SBAR.
Right, get examples, yeah, for sure.
And gather as much information as you can. for sure.
Mm-hmm. Have you guys had a bad experience with giving SBAR? Or pretty good?
Yeah, I think I mean, the more I practice it, I think the better it gets. But the first few ones were a little rough.
Yeah. Well, because you don't know what to expect, right? So, so before I turn it over to third semester, questions, comments, anything? Right, watch these 2 team steps videos if you haven't already, because they're good examples of SBAR. I'm gonna stop sharing my screen. I'm gonna keep recording so that people have the information. And seriously, any questions? You guys are, I mean, it's kind of a review from 110, but hopefully we've got therapeutic down. We've got some tools in our pocket now to use when we're interacting with our patients. You guys can practice some SBAR and you'll be good to go. All right, who's going first, men in nursing or SNA?
SNA.
SNA, okay.
Okay, we'll go first. Hi, everyone. As I think most of you know me by now, I am the president for SNA. And I have Steven here with me. He is our vice president. And we just wanna go ahead and invite you guys to our first SNA meeting that's taking place today at 1:30, I believe. And at 1:30. And then I think Ms. Sillinger shared with you guys the Zoom link for the meeting. If I'll go ahead and, well, I think she's the one who shared it.
It's on did I put in an announcement? I think I put it in an announcement. I can't remember.
Okay. And then, yeah, come see what SNA has to offer, what we're all about. We are trying to incorporate helping you guys as much as we can because we know times are tough and you guys have it, I think, a little harder than us because you guys are online, so you guys don't have that time to interact with with one another. So we're gonna go ahead and try to offer that through SNA as well. And we wanna go ahead and help you guys out. So something that I am going to be trying to do for every meeting is trying to have resources for you guys. So I'll go ahead and reach out to my classmates and see if they had any specific resources that they really feel like they used a lot during first semester, and we'll go ahead and have that for you guys. And like I said, we would love to have you guys there, and especially if you're thinking about running for an officer's position, I think it would be great if you can be there starting from the beginning so that you can see what kind of things we do as officers for SNA as well. And you can go ahead and start learning, and we can go ahead and start mentoring you guys for when you guys take over. I think Steven wants to share some info with you guys as well.
Yeah, and our big focus would be just kind of creating community within ourselves. I know with COVID now, we don't really, I mean, we probably won't see much of each other this semester. So just, we want to try to, like Sonia said, just be there for you guys. I know times are tough. Trust me, we've been there, and I can only imagine how it is now with everything having to be online. So we want to kind of be there a little bit more for you. Like Sonia said, provide resources for all of you, and know that we're here for you. Don't be afraid to reach out. I know, like if you need help with skills, if you need help with any like theory concepts that you're not kind of grasping, I know the majority have mentors, but just come join us. And we do a lot. We do fundraising. We're going to try to do fundraising. We're going to do a toy drive. We're going to do a variety of other things. So just come join us, and then you'll see what it's all about. It's fun, right, Sonia?
Yeah, definitely. You'll learn a lot as an officer. You get to interact with your classmates, and speaking for myself, I never thought that I was gonna like have an officer position, but I've learned a lot, and it helps a lot. It does come with responsibility, but I feel like it helps you out as well. So definitely keep that in mind. And like Steven said, reach out to us. We're here for you guys, and we will try our best to help you guys in any way that we can. And if we can, we'll try to go ahead and find a solution with you guys.
Yeah, and after our SNA meeting today, we're gonna be, I know you guys start clinical on Tuesday?
Mm-hmm.
Yeah, so we're just gonna be going over like what to expect. Might be a little different now, but what to expect, and just like ways to keep sane and ways to just be prepared on the first day, because I know it's intense. So yeah, come join us. 1:30. Links in the chat, right?
Yeah, I just put it in the chat. There is a slight conflict. I'm not sure what time Mr. Beamer's doing success class. So I don't know if there's any way, if you would be willing to record the meeting for people that couldn't be there. I'm just offering that as a suggestion. I mean, I'll be there, but because there are great advisors, you know, for SNA, just saying, Ms. Thorpe and myself, and maybe record it. I don't know how you guys feel about that, but maybe for people that couldn't be there. Thanks, Stephen. As an option. And again, if this is a one-off, it's normally on Mondays, so there won't be the conflict.
Yeah, we can record, right, Sonia?
Yeah, definitely. I'll go ahead and record the meeting. And I think there's a question asking if we can invite people that don't have a mentor to reach out. I know some of them that would like to have a mentor. Yeah, definitely. If you don't have a mentor and you would like one, come to the SNA meeting and I will go ahead and try to find you a mentor. And if I can't find you one, I'll go ahead and be your mentor if you want me as your mentor.
Sonia's awesome. She would be an
You
awesome...
want her as your mentor.
Yes.
Just saying. Is there questions on officer positions or anything? I think we're going to probably wait another week or two. I think students, and correct me if I'm wrong, but you guys know each other pretty well within your cohorts and even within your AM PM groups, but it's the it's getting to know people in those other time frames.
Right.
Yeah, so oh, oops. And then oops, hold on. There we go. Or if people looked over the job descriptions, do you have any questions?
I actually have a question. I noticed it said that for a lot of the positions you have to attend the faculty meetings. What does that entail? Is that like the meetings you guys have Monday mornings, or is that something different?
So that actually, if I can take that one, because we've actually changed it a little bit from the faculty perspective. There's faculty meetings. This Monday is program evaluation. Curriculum is the third week. I'm the chairperson for curriculum committee, and then we have policy and procedure committee. And it is helpful if the SNA officers or people that are in SNA attend those meetings, but we're actually this semester going to send out invites to all students, right? It doesn't just have to be SNA officers or representatives, right? We're going to send the link to the meeting to all the students, RCP, VN, EMT, RN, everybody as well. So I would leave it up to you guys in SNA to decide if you still want to, how you want to divide that up, if you still want it to be officers or reps, that kind of thing. And our meetings on Monday mornings, even though they're scheduled from like 8 to 11, generally it's like an 8 to 9 or 9:30 that we're on the meeting together, and then we break out into individual groups to do the work that we need, the group work that we need to do.
Yeah, for us, in the previous semesters, what we did through SNA was we took turns as officers going to the meeting so that we don't all go at the same time. And then whoever attended the meeting would go ahead and fill us in on what was talked about and what was said. That way we take turns and we have more time availability for us.
Thank you.
Any more questions as far as officer positions?
What's the deadline for the officers? When do we have to finalize our group?
There is no real date. I know, Sonia, you'd like it sooner than later. So I'm hoping, like, where are we, week 3, 4, 5, like maybe week 5, 6, or maybe put a slate together by week 5 and then vote in week 6, something like that. Does that sound okay, Sonia?
Yeah, that sounds fine.
I know you want it sooner than later. It's just harder for them to get to know each other. And even though everybody wants Hugo to do everything, that's just not physically possible. So
yes, it is. Yes, it is.
No. So
I have a suggestion.
Yeah.
I was talking to Sonia about this and a couple of our classmates, because we don't know our class very well. Like, COVID hit us, so we're all split up. So technically our class is, we have 10 students. That's pretty much our class. So my suggestion will be, I talked to Sonia about this, is probably out of those cohorts, just pick up a captain, right? Since we kind of all mingle within each other, so we kind of know each other. And out of those 4 captains, probably they can be the ones kind of like fighting for the positions that will be the top tiers. I believe is president, vice president, treasurer, and I don't know, fill me in, Sonia. I don't know what's the other?
Secretary.
That'll be my suggestion. I don't know how the class feels about that, but like I said, it will be unfair to throw Hugo in there for everything.
I mean, yeah, we can talk about it. I don't think it's a bad idea by any means. I think we're going to have to do some out of the box thinking given the times that we're in currently. So that may be a good solution. And yes, it would be a good idea if people want to say they want to run for positions. I think that's good as well. I think we need to talk about it, but not here, because we need to let men in nursing come in and do their thing. And then we have, I'll push the start of 47 back a little bit, but we have 47 after this. But I think both of those are really good options, and they're not mutually exclusive, I don't think. So I think we just need to be creative in how we want to do it. Because certainly if somebody wants to do something, wants to be involved, I think, yes, we need to have that opportunity. But I like the idea that each group would have representation as well. Do we want to move on to men in nursing? Miriam, do you want to, is that?
Yeah, Ray's going to start us off.
Oh, hi,
Okay.
Ray. Yeah.
Hi, I'm Salinger.
Hi.
So hi everyone. I'm Ray, the president of Men in Nursing Club, and I have our vice president Miriam with me as well. We're here today to invite you guys to our first meeting next Monday at 1 p.m. So we're going to talk about a little bit about our club. Get people interested in joining. And Miriam and I want to thank Mrs. Salinger for giving us the opportunity to talk to you all. Round of applause. I'll try not to take up too much of your guys' time. So Men in Nursing is in a club that's exclusive to just the guys in here. Anyone can join. It's more to represent and support the idea that nursing as a profession isn't confined to one gender. You don't have to pay any fees or any memberships to join, like SNA or A1. It's totally free. And we don't want to stress you out any more than you already are, as this is supposed to be a more casual, fun club. Just like SNA, we're also available to help you guys transition if you need practice or any help. We'll go into more detail about our plans this semester in our first meeting, but is there anything you want to talk about, Miriam, what we have in store or why be part of the club?
Yeah, we would like you guys to come just because we want to bring guest speakers to you guys, like nurses in different positions. And we want to take your guys' idea of what kind of nurses and what kind of positions you guys want to hear. And that way we can try to reach out to nurses and have them come So we want to hear what you guys want before we go ahead and set like a schedule for our meetings. But for the first meeting, yeah, we would love to have you guys there. And I know you guys already have a lot on your plate, but just remember that it would look really good when you're either applying for scholarships or building that resume that you're in different clubs. I'm actually part of both clubs. I hold a position in both SNA and Men in Nursing. And just remember that when you guys graduate, there's going to be, I don't know how many are in your class, maybe about 40 of you looking for a job. So just remember that you want to stand out from that other person that's applying for the same position that you are. So it looks really good to just build your resume, join clubs, and just stay connected and make connections. And as all of my other classmates said, we are going to be there for you guys. So just feel free to reach out whenever you guys need to. And it would be good to just socialize at our clubs and just, you know, get a little bit away from the homework aspect and just hear what we have to do and just what we're going to do or try to do within the community just because of COVID kind of holding us back this semester. But yeah, if you guys have any questions, feel free to reach out. We'll leave our emails in the, I'll leave my email in the chat. I don't know if you guys want to do the same.
Oh, I created a Google form. Yeah, I linked in the chat a Google form. If you want to like sign up for our email list, as well as I included the Zoom invitation in there. So yeah.
Okay.
So just to repeat, our meeting will be next Monday at 1 p.m. So if you do have any questions, please reach out to either of us. We hope you can attend, and we want to welcome new members. So yeah, come join us. On a little spiel, a little plug-in. If anyone is still interested in having a mentor, or just simply want to talk about the mentorship program or anything, you know who to reach out. Or Kevin.
Or Kevin. Nice. Sonia, can you, thank you guys from Men in Nursing, Miriam and Ray. Sonia, can you briefly say which weeks are SNA or Men in Nursing, like what the meeting schedule is?
Yeah, so for SNA, it's every first Monday and third Monday of the month. This week, it's a little bit different because Monday was a holiday, so I didn't want to like do it on a holiday. So that's why we switched it to Friday. But from now on, it's going to be every first Monday and third Monday of the month. And I believe A1 does every second and fourth Monday of the month.
Yeah, there's A1 is at 2 p.m. on Mondays and on Mondays. So we are supposed to be 1 p.m. So we're gonna try and make it short. If you guys are interested in A1 as well.
Sounds
and it's possible because I make it to both.
Good job, Miriam. Yay.
And I went to a couple of the Men in Nursing meetings last year, and it was really, really cool. They had a couple of guest speakers come in. One of them was an actual working nurse, and we got to like grill them with some questions and stuff like that. It was really cool. But yeah, Men in Nursing was really fun.
I hear A1 has a pretty cool guest speaker coming up this month too.
Oh yeah.
You know, a real live nurse type person. And then someone was asking about the time commitment. Like, what do you, if I'm guessing if, or like officer, between officer and member, like time commitment to be in any of the clubs?
I think it varies.
Mm-hmm. It
Usually,
does.
I mean, I don't know. What do you think, Sonia? Maybe like a few 4 or 5 hours
like,
a month?
Yeah, like five hours a month. I think
That's
it
just like
varies
ballpark.
on what you want to do, because once you take over SNA, you decide what you want to do with SNA, like what the activities or guest speakers or whatever you want to do is like kind of like you decide how much time you're gonna commit to it. But I feel like for my end, I feel like a good 5 hours a month is more or less the time that I dedicate to SNA.
And I think first semester might be maybe potentially a little bit less because you're learning. You're not, I mean, yes, you have officer positions, but you're not necessarily like you're being, like you're learning about how to do it. And then in second semester when it is you guys, you know, then I think the time creeps up to that more 5 hours-ish.
Yeah, when I first when I first became president, I wasn't putting much time into SNA. I was just kind of getting a feel of what it was that I was going to be doing. and it was a lot of learning, but nothing out of like my own time. And then once I took over, yeah, the time became real.
All righty. Well, if that's if nobody has anybody have questions or whatever, thank you guys. Thank SNA and Men in Nursing, and I'll say A1. Miriam can represent A1, and yeah, you know how to get a hold of them, right? Definitely plug for the mentorship program, and it's really fun. It's a nice yeah, it's nice. Join. Again, what membership for SNA is $40, I believe, a year. Is,
Yeah.
And is there a fee? There's not a fee for Men in Nursing or A1?
For A1, I believe there is, but Men in Nursing is totally free.
Okay. Yeah, Men in Nursing is free, I think, because it's our club, whereas A1 and SNA are also state and, you know, sponsored clubs as well. So there's probably a fee for A1. I just don't remember off the top of my head. Ms. Clark is one of the advisors, I believe. Yes, for A1. Miriam, is that?
Yes.
So you could check we can check with her to find
But
out.
you don't need to, if you don't want to, you don't need to pay for it, and you can still come to our clubs.
Mm-hmm. Yeah. So cool. All righty. You're welcome. You're welcome. So why don't we say, you want to come back at 10:15 for 47? That gives you guys like the half hour that you would have had, right? Yeah, we good. I'm seeing thumbs up. Okay, so we'll come back for 47 at 10:15. Yay, bye.
Bye guys, thank you.
Thank you guys so much for coming.
Thank you.